Social welfare has a broad meaning, including activities that support other humans or groups of people who form society or nation, and people with disabilities to have physical and mental happiness. They should be provided with basic living necessities such as food, clothing, shelter, healthcare, education or training, and certain knowledge for living a good life and maintaining social order and stability. Royal Address of His Majesty King Bhumibol Adulyadej. In Thailand, some people experience inequality in healthcare, which is rooted in a lack of political, social, and economic power. Most of such people are women, children, the aged, displaced people, ethnic minorities, inmates, people with disabilities, people suffering from chronic illness and conditions. Vulnerable populations are defined as those at greater risk for poor health status and healthcare access, and those without adequate potential access to care. Collaboration to develop social welfare and healthcare for vulnerable children. Due to changes in economic and social conditions, along with global society, Thailand is one of the countries that are faced with the problems of population structure and quality. The children and youth situations that Thailand is facing, especially those related to underprivileged or vulnerable children, are, for example, child abandonment. Today, the country has a number of neglected children, despite its efforts to resolve them in all dimensions. Phayathai Babies Home, a case study about care and problem solving for socially underprivileged or vulnerable children. The Phayathai Babies Home, or Phayathai Child Welfare Center, has been operational for over 60 years. It is regarded as the first welfare center of Thailand, currently under the Ministry of Social Development and Human Security. The Babies Home takes care of neglected children, including newborn to 7-year-old orphan or poor children, who are neglected and have no patrons, or from a poor family. Angkana Chai Kitsuwan, Guardian Phayathai Babies Home, said, "Here we take care of about 400 babies. We believe that every baby can be developed. We are confident in the capacity of our personnel in working with babies. We have many different networks or organizations that are ready to help us do our work more efficiently." The Babies Home major duties begin upon the child's arrival at the home. The child care provided includes health care and support for child development, education, and seeking, as well as sending children to adopted families, which really want to raise the children. All concerned perform such duties with good attention and intention. Beginning with healthcare, the new coming children will undergo health screening as well as medical treatment, depending on their physical and development conditions. And then they will be sent to a welfare home, depending on their ages, under the care of babysitters or caregivers, some of whom are volunteers. Healthcare for children is provided in collaboration with Ramatipudi Hospital, including physical examination, treatment, and health assessment on a continual basis. Dr. Pong Thong Puraniti, pediatrician, Ramatipudi Hospital, said, "We come in to care for children in terms of physical and mental care, disease prevention, health promotion, curative care, and rehabilitation, so that they will be ready to go back to live in society with quality. We focus on screening of children with health risks so that physical examination can be performed on a timely basis. Young children need to receive close and special care as they are in a vulnerable group, living close together. Caregivers need to have skills to prevent them from physical and mental illness. In addition to healthcare, child development is another important aspect of childcare, undertaken by caregivers or officials who have been trained in various aspects of child development by staff of Ramatipudi Hospital. Today's training session aims to enhance the capacity of caregivers in supporting child development, which currently comprises several activities at the baby's home. Associate Professor Dr. Nichara Ryangdarakanon, Chief Child Development Unit, expert in child development and behavior, Ramatipudi Hospital, said, "We work on a proactive basis. Our team will come here to provide technical assistance to child caregivers, provide counseling as a child development behavior expert. That is because they are faced with many kinds of children. Some need love and close attention. If the caregivers understand this matter, they will take good care of children." Regarding the development of child health, important supplementary methods have been introduced continually, such as premise design and other development enhancement activities according children's ages. These are parts of child preparedness as, in the future, they will be taken care of by adoptive families or parents. But before that arrives, all relevant sectors are requested to coordinate in another important aspect of childcare, the seeking of patrons, while waiting for adoption by adoptive families in the future. Today is another day for social welfare officials to make home visits to the patrons who have taken children under their care. Today's field visit is being made in Saraburi province, about 100 kilometers north of Bangkok. The visitors bring with them some necessities including food items, consumer products, books and toys for the child and patrons. The visit is made every 2 months to also follow up and assess childcare in various aspects. Similarly, this family has taken many children from the Phayathai babies' home on several occasions under their patronage. At present, they still have a good connection with the children as if they were their own children. A granny who is a child foster said, "I am single without any burden, so I am ready to take care of a child. I have done so for many batches of children, like fulfilling each other. I take care of them as if they were my own grandchildren or family members, teaching and training them to help themselves, and giving them love and compassion. I have seen their constant progress. I am glad to have them with me and see them happy and grow up with quality." After the children are prepared, one day they will go out of the baby's home to live with their adoptive families, either Thais or foreigners. Belgian adoptive parents said, "We have been married for a long time but have no children. We used to spend our honeymoon in Thailand and are very impressed with the Thai people. We have applied for adoption, and today is the first day to meet our adopted child who will be living with us. We are very excited and very glad that she will be part of our family, making our family a perfect one. We are ready to raise her to the best of our ability." Angkana Jaikitsuwan, Superintendent, Phayathai Babies Home, said, "Host, father, and adoptive families are those that provide safe and stable care for children with love and warmth. When the children grow up as adults, they will become good citizens of society and help society, and there will be no social problems in a cyclical manner." As for Thailand, to minimize social problems that may arise, the children needs welfare protection in terms of their physical, mental, and emotional conditions, so that they will have a chance to grow up and become quality citizens of society and the nation.